just wanted to ask you, Alex, first of all, what your experience is like right now working in the Montreal healthcare system.
Okay, so like I mentioned earlier that like the priorities, I guess the experiences are always like changing as the pandemic takes its course. I would say the ER right now, if you ask me today, I just had a shift last night. Like, it's calm. Like, it's not, these COVID patients are pretty heavy. You have to take a lot of extra precautions, but because we're relatively equipped in terms of PPE, and we were also trained quite extensively on the use of the PPE and the proper protocols to not basically contaminate either environment around us or ourselves. We've been relatively safe in our ER. I think we've only have like a few workers that have tested positive, and we have one of the biggest ERs in the province. We have over 300 people working there. So that's what I say. I feel like, safe at work. There are things that are frustrating in terms of, we're continuously being asked to ration more materials, reuse more materials. That's sort of frustrating, but compared to other areas of the healthcare system where they don't have any PPE at all, I find like we're relatively well prepared in that sense. There's a huge issue right now in Quebec with the long-term care facilities, and there's a lot of cases that are basically blowing up over there. I know you want to keep it short, so I won't go into too much detail, but yeah, I can talk to hours. I've been, speaking with a lot of people about that and what are the big issues around that. But we're just, because on the front lines now, we're seeing a lot more healthcare workers and patients from those facilities coming in. I think a report was just published this morning saying there was 4,000 healthcare workers in the system, the majority of those in long-term care facilities that have tested positive for COVID. So it's pretty significant.
And are you saying that those workers who are being tested positive, do they have proper PPE? Is that the understanding?
No, they had no proper PPE, no training, no preparation, like everything we did in the ER. And you have to understand, like the ER where I work, it's like we've been seeing corona patients since January. It's like one of the corona designated centers in the city. So, but these other places, they're rationing masks. They're not even giving masks in some areas. Some don't even have them. Workers are afraid to show up to work. Workers are getting sick. Like, they're staying at home. Just like over the last few days, like they've been sending ER nurses and nurses from other facilities to some of these private care facilities, which have been virtually just completely abandoned. There's no healthcare staff or anything there. So these tend to be private facilities, so I guess they have less resources or less coordination than the public system in terms of filling those positions. That's only, but public system as well. There's lots of centers that are facing extreme shortages now, and also having their share of huge big outbreaks. So yeah, this is sort of just one of the big issues, but it's directly related to the staff not being trained properly and them not having the proper PPE.
Okay, and Haley, in terms of your experience, what's going on in your workplace?
In terms of PPE, so we have had to disinfect face shields to be able to reuse them. And we have also been running out of, there's been a shortage of like Virox wipes, like disinfectant wipes, basically. And we've really had to kind of limit the amount of, limit the amount of contact we have with even suspected patients. So I guess on my unit, we don't, they're not confirmed necessarily. So if they present symptomatic, then we just kind of put them in isolation before they're confirmed. And that's where, I think that's where the shortage of the PPE equipment is. Like sometimes we'll run out of gowns for the weekend and things like that. So yeah, in terms of protective PPE, it's been an issue. I think I technically work in a green zone, but
and so what's a green zone for?
So a green zone means that technically we shouldn't have any COVID cases on our unit or any any sort of cross contamination. Kind of the weird thing about the Douglas though is that we actually so we have a red zone. We have a unit specifically designated for confirmed positive COVID cases, and we have a yellow zone. So a yellow zone would be symptomatic, but we don't know. We're waiting for the test. And the staff who work on these units also tend to go in the other departments. But I guess, sorry, what I'm trying to say is that even though we have these zones, the Douglas is not technically recognized as a frontline sans activité hospital. And so our union, unfortunately, we're still trying to fight to get the additional prime.
In terms of preparation around training, do you think like that was adequate, or like was it something that the hospital was addressing early?
I think maybe for the COVID unit, yes, they were training and they had materials for that particular unit. But it was really the rest of the hospital, right? So the cases that we didn't, of the patients who were symptomatic, that we didn't really know what to do with. Because obviously certain, like the protective gear would go more towards the COVID units, right? So even if they were symptomatic and we had isolated them, we unfortunately wouldn't necessarily have all the equipment on the other units for it.
And so I just want to get back, and maybe Abby, you can talk to this, is about the preparation, or kind of what was the state of Quebec's healthcare system going into the crisis. I know here in Ontario, where I am at, that there was decades of cuts that had reduced the amount of hospital beds, that had seen a sort of drastic reduction in quality of service and reliance on for-profit long-term care facilities. What's going on in Quebec, and how does that impact what's happening with the COVID crisis?
Yeah, I think there's a fair amount to unpack with that. I mean, even just taking the example of the long-term care facilities, right? So that's an example of, like Alex had said, sort of a push towards privatization. But also that, you know, in 2015, there was sort of a consolidation under the Barrett government that had moved a lot of power from more localized boards into these sort of large CSs. And as a result of that, you know, the accountability just gets getting further and further away. But, you know, as late as 2018, there was a huge crawl out for, you know, nurse-patient ratios. Like we knew in CHSLDs, the nurse-patient ratio, the staff-patient ratio was very unsafe. Unsafe for the patients, unsafe for the folks who were working there. And, you know, there had been a large call out from different nurses to give their témoignage. We heard that, you know, this was a problem all across the province. And despite, you know, it being one of the CAC's sort of platform issues around healthcare to bring in nurse-patient ratios to sort of make more safer health centers across the board, we haven't really seen much. Compulsory overtime is still very much the standard in the way that folks are managing staffing on units. And that's even pre-COVID, right? So, you know, we're talking about a system that was already sort of being held together just by the gumption of the healthcare workers involved, right? And just people who are really already at the edge of their seats, their end of their ropes. And so now we've been really tested with this crisis, and you know, all of those issues have really come to a head, right?
And so maybe Alex, and all of you really, I'm curious, what are healthcare workers doing in terms of organizing to fight the cuts? What was happening before the crisis hit? And then in terms of what's going on right now, what are healthcare workers demanding and organizing around? And maybe go into a little about how they're doing that. So maybe Alex, and then we can
Yes, well, like, well, I guess before we would, we were meeting with ministers, we were lobbying, we were protesting, all the standard stuff. Nothing really was budging. It seems like the only time you ever get any big, huge push is when something blows up in the media, some either like horrible tragedy or just basically some like appeal that basically basically makes the public aware of what's actually going on. I was actually speaking with like another reporter about this today. I think there's a big issue like in the healthcare system where, we're in a universal public healthcare system and the public has a right to know what's going on the ground. But there's this huge like omerta, like this law of silence that, healthcare workers aren't supposed to speak up. They're not supposed to discuss anything that they're seeing. And it's actually really unfortunate because I don't think, I think the public is seeing a lot now because the spotlight is on the CHSLDs and is on the healthcare system in general. But I don't think people really realize just how broken and just how under-resourced a lot of these areas were until this whole event happened, even though for years we've been saying it. And I think the difficult thing is this, like, we know we can't bring a camera into these different facilities and film and show what we see on a daily basis. But, what's happening now has been happening for years. So, we've been advocating as best as we can, but, until like, you really get that spotlight in the media and the public is really just like, shown what's actually happening and why we want more resources and, improvements to the conditions that we're working in. Nothing really changes. And essentially now that's what's happening. A lot of people are, so with the PPE thing, like, I ended up going and meeting up with a whole bunch of people in the grassroots scene in Montreal. And there's actually all these things happening through informal networks of being able to provide PPE on the ground. So that's it's super cool that you have a lot of people out in the community that are really trying to help healthcare workers. And, if we can't work through the existing institutions, which are incredibly bureaucratic and political, and there is just a lot of overhead that you have to deal with before you get anything done on the ground. At least we have these grassroots movements, which, they tailor, I find, way quicker and better to the needs of what we actually having. Specifically because the needs are changing so fast. So, it takes time to get things moving in a bureaucracy. But, when you're dealing with people on the ground, you can just speak to directly with what are your needs. You can speak directly to the person who has a solution for that. And then just a lot of nurses, more and more nurses I find are going to the media, just realizing that, a lot of those existing pathways that we used to use to voice our concerns just don't exist anymore, or they're just inundated with all the communication that's happening. So they're just finding that, just going out and sounding off on Facebook or going to the media is the best thing right now to at least get our concerns addressed get our concerns all the way to the very top where they can actually be addressed properly. Yeah.
Yeah, and obviously, are there, I don't know in Montreal, but I assume there's like community-based claps for frontline workers that are happening.
Yeah,
And
there's two. I've been working with Dunny
as well.
What's that?
Do you think that's creating an audience for people to sort of listen to healthcare workers about what they want and need?
Well, it is, at least it tells, like, they know the needs that we're having. They're also, like, one of these groups, Donner la Protection, they're in this weird ethical situation where they're hearing a lot of the needs and they see them, firsthand, because the people know, like, this is who you have to contact to get equipment. But they're also, like, they're just the middle person. They don't have any long-term solutions. Like, the solutions really have to come through the top. But yeah, nurses are writing editorials. Nurses are, like, we've been soliciting politicians who are listening. I don't know how effectively they're passing the message, but yeah, like, hopefully after all this is done, there's going to be some big changes as a result of this. But yeah, today it's just too hard to tell, like, what's actually going to come to long term. But things are moving. People are trying to move things along, but just given, like, just how big the issue actually is right now, it's hard. Like, a lot of the stuff you should have been prepared well in advance. Like I said, like 20 years ago, we've been talking about how the healthcare system was underfunded and how that basically we don't have adequate staffing levels and we don't have adequate resources. And if we ever have a huge issue, we were talking more in terms of the baby boomer situation there, that in 10 years, you're basically gonna have a system that's oversaturated with elderly patients. But this pandemic, I think, sort of brings to light what we were worried about happening in 20 years, but it's just happening right now, more acute.
And Abby and Haley, like in terms of, from your perspective, what needs to change, and then also kind of how healthcare workers that are organizing to kind of facilitate some of this change. Is that happening in your workplaces or with other healthcare workers that you know?
So I find that it's really kind of difficult for us to organize because of the government degree. Like typically our unions would be our outfit. That really hasn't kind of taken away our collective agreement. So we don't have a lot of power that way. But it's like Alex said, a lot of so I've seen nurses on YouTube writing editorials, probably more, from what I've seen, more informal channels, means like that, yeah.
Yeah, I think moving forward, there just needs to be much more frontline representation on decision-making bodies. I think that's kind of the big take home, and not just nurses, right? Like ensuring that PABs, personal support workers, folks who are involved in the multidisciplinary team are also getting a say, particularly at the political table, of what's going on. Whistleblower legislation, I think, is something that we really need to get in. Folks who are advocating for patient safety shouldn't have to decide between whether or not they keep their jobs in order to be able to go to the media, which I think it speaks to how rough things are, because it's not as if COVID-19 being present stops people from having those obligations to their employer. Mm-hmm. It's just that they're now risking their jobs, their livelihoods, to sort of get the message out about exactly how bad this is, right? Yeah, and there does need to be more of a push towards evidence-based staffing, making sure that ratios reflect what we know is being safe, what we know is being, good, not only for the patient population, but to maintain a healthy workforce, right? So moving forward from this, it's going to take a while for us to be able to get our workforce back up. But making sure that we actually have the hospital capacity, that we aren't dealing with a burnt out staff, with management who are on sick leave, with all of the things that we sort of came into this situation with, should also be looked at.
Yeah, and something that happened, I don't know if it's fully parallel to what's going on in Quebec, but what's happened in Ontario is like that years of cuts to beds and stuff has pushed capacity overflow into the for-profit system, and that like in the LTCs is what is failing, like where we are seeing like the highest rates of deaths. And that's not because those workers are bad workers, it's because they're in a for-profit system that just squeezes them and squeezes staffing levels to the maximum, and and that is a real problem. So I think that your kind of focus on staffing issues is very, very important. And so in terms of going forward, are you hopeful that, like, this is a question to all of you, are you hopeful that there's going to be changes coming out of this? Or Alex?
Yeah, I'm hopeful, but skeptical at the same time. I know, they always do the minimum that they can get away with. When I say they, I mean, elected officials on top. I think it's also I blame the politician a lot, but also I don't want to blame the general public. But at the same time, in a universally funded healthcare system, I think people have to realize, if we want to have quality health, quality safe healthcare, and avoid situations like we're seeing now, or situations we've been seeing for years, we unfortunately have to pay for it. So it's either that or go privatization, which, then you end up in situations like you have in the States, where you have a lot of people that don't have healthcare. So I think, we always put a lot of pressure on the politicians, but they're also responding to, demands by the people that put them in power to not spend, like not spend the amount that they should be in healthcare. So I think it's just like collectively as a society, we have to understand that, you know, healthcare does cost, but it does, you know, healthcare employs people. Healthcare, there's a whole bunch of services that are involved in that, but we just have to, you know, invest more in it in the end. And either if it comes from public, you know, at one point or another, like, you know, the money has to come from somewhere for this thing. So I think that's just sort of the big thing in the end, because I know the politicians, they're just going to, you know, they're put in there to balance the budget and limit the amount of spending and, you know, implement austerity measures and whatnot to try to save the system money. But, you know, if we keep working like that way in healthcare, and if we keep just working reactively than proactively, you know, these problems are just going to persist into the future.
Great. And Haley and Abby, in terms of, oh, yeah.
No, sorry, go ahead.
Oh, no, it's just same question. Anything that gives you kind of hope? Do you think things are going to change out of this crisis?
Yeah, I think, like this is going to be there's going to be a huge, you know, debriefing, and this is a moment of reflection for nurses, like, and of nursing. We're going to have to ask the tough questions, like, how much power should employers have? How much power should politicians have? Like, should we be portraying healthcare workers in this light when we ourselves can be vectors and things like that? But I'm very hopeful. I think it's, you know, these moments of reflection that will inevitably bring change. So. Mm-hmm.
Yeah, I'm hopeful. I think that, you know, there's good momentum. Like Alex said, you know, we do need the momentum from the general public, you know, both in terms of being able to support a universal healthcare model, but also, you know, for folks to hold the government accountable for how it's taking care of the community health population, right? You know, so it's great that we've, you know, we've been managing to build these beautiful super hospitals, and I think as part of trying to decompress the ERs, and which is super important, you know, we need to have really strong community healthcare, right? And long-term care centers, nursing homes. That's the future, right? Making sure that these are safe places, that these are well-staffed, that these are places where people are able to feel safe, dropping off their loved ones, where they can grow old, safe and comfortably, and where staff want to go work, right? So making sure that, you know, the community healthcare, the home healthcare, the CHSLD, but also the CLSCs, sorry. You know, that network is really propped up for what it is, right? Which is the, you know, the fundamental part of healthcare, right? Keeping people at home, keeping people safe, keeping people kind of away from the ERs.
Great. So yeah, thank you. I think that's super important. And again, yeah, thanks so much for agreeing to talk to us. That was very helpful and informative.
Great.
Excellent.